Hi, my name is Steve Hauser. I'm the current president of the American Heart Association, and I'm here this afternoon with Dr. Mark Creager, the immediate past president of the AHA. And Mark is here to tell us a little bit about some recent clinical trial data that was released today in a hotline session entitled Coronary Artery Disease and Imaging. Thank you, Mark, for being here.
Well, thank you, Steve. It's delightful to be here in Rome at the European Society of Cardiology meeting. So at the hotline session today on coronary artery disease and imaging, there were several interesting trials. Now, two had to do with the role of non-invasive imaging to preclude the need for invasive coronary angiography. The first was called the conserved trial. Now, the conserved trial enrolled 1,500, a little bit more than 1,500 patients, and randomized them to two groups. One group underwent coronary CT angiography. The other group went directly to invasive coronary angiography. Now, these were patients who had symptoms of angina, stable angina, and suspected coronary artery disease. So, of the group who underwent coronary CT angiography, there was an 85% reduction in the need for invasive coronary angiography. And at 1 year, that translated into a savings of $3,000 US. So a pretty significant difference. Now you might think, well, maybe going to invasive coronary angiography led to more interventions and a reduction in major adverse cardiovascular events. That was not the case. There was about a 5% incidence in MACE in the two groups. So comparable outcomes, but a substantial reduction in cost in the patients who first underwent coronary CT angiography. So interesting finding. I think will have significant implications as how we move forward in the diagnosis of these patients. The second trial was similar in context, but had a different strategy. In this trial, patients with suspected coronary artery disease were randomized to one of three groups. One group underwent cardiac magnetic resonance imaging to assess myocardial ischemia. A second group underwent nuclear perfusion scintigraphy. And the third group were treated according to the NICE guidelines. And based on whether the third group was thought to have low, intermediate, high risk, they may have undergone preliminary non-invasive testing or gone directly to coronary angiography. So as it turns out, in the groups who underwent cardiac MR or nuclear perfusion scintigraphy, there was a significant reduction in the performance of unnecessary coronary angiography. Now, unnecessary was defined at the time of invasive angiography by using fractional flow reserve or quantitative angiography. So in the groups that underwent cardiac MR or perfusion scintigraphy, about 8% of those had unnecessary invasive angiography. Of the groups that were treated according to the NICE guidelines, there was about 28% of those patients underwent unnecessary angiography. So once again, we have a trial that indicates that using non-invasive imaging to assess the likelihood of significant coronary artery disease in patients with suspected coronary artery disease reduced the risk of invasive angiography. So it compares nicely to the conserved trial, which looked at coronary CT angiography. So two trials indicating that maybe we have to rethink some of our guidelines in terms of when we should do non-invasive imaging. So this next trial actually compared three non-invasive imaging techniques in patients with suspected coronary artery disease who all first underwent invasive coronary angiography. So the comparisons were PET, SPECT, and coronary CT angiography. And it turns out of the three, PET was best in predicting the magnitude of myocardial ischemia. So we're not typically doing as much PET as we are the other techniques nowadays, but this trial, I think, sets the stage and really raises the bar that maybe we should be considering PET as an appropriate non-invasive imaging test to assess the severity of myocardial ischemia in patients who we do suspect coronary artery disease.
Thank you, Mark. Those were great summaries, and thanks everyone for listening.